Hey friends, and welcome back to another episode of The PA is In. I'm your host, Tracy Bingaman. I want you to picture this. You're good at medicine. We know this, right? Like you're really good. Clinical decisions you're making without having to think. You've got years of experience. But the system around you, the pace, the staffing or lack thereof, the just squeeze one more in, do a little bit more, do the right thing for the patients because you care. The meetings where you're basically always the squeaky wheel and you have all of the questions, but nothing ever changes, it's exhausting. You can be clinically bored. Like you're the subject matter expert, you know exactly what to do for your patients, and you're very rarely puzzled by the presentation. And logistically, you can be burned out at the same time. And that combination is brutal. For a lot of us, the question then becomes, do I keep trying to fix a system that doesn't want to change? Or do I build something that actually works for patients and serving them well, and for my life and serving myself and my family well? That's what today's conversation is about. Kathryn Werner is a PA, a telemedicine practice owner, and the founder of White Pine Mental Health and Wellness. And she also supports clinicians through CPAC as they launch and scale their own practices as clinicians turned entrepreneur practice owners. Whether that's virtual or in person, whether it's lean practices, seeing a few patients here and there, or big and bold practices with all of the supplies, all of the rooms, and the incredible aesthetically pleasing waiting room. This episode is going to be super practical. We're talking about what it takes to start a practice, both timing and money-wise. What flexibility actually look like when you have kids and a real life that you want to pursue outside of entrepreneurship and running your practice. How to hire your first virtual assistant, in-person assistant, or another clinician to join you, and how to build a practice that supports your life and where you have boundaries that are clear and enforceable instead of destroying you along the way. Because if you're working somewhere where you have to ask permission to prioritize what you would say is your number one priority, yourself, your health, your family, is it really your number one priority if you can't make that choice yourself? All right, let's dive in. There was a moment not that long ago where I realized something that made me really uncomfortable. I realized that clinicians are the best people to fix the way that we deliver care, but most providers have no idea how to run a business. We jump into entrepreneurship thinking, I just need a great idea, the perfect logo, maybe a website, no sales, no beta testing the market, not beginning your business with the end in mind. But then we wonder why it feels so hard, why our business is not growing, and why it's not paying us much or at all. Because no one taught us how to run a small business. Here's the reframe that changed everything for me. Your business is like a body. And if you don't know how to assess, diagnose, and treat it, it gets sick, needs resuscitation, and dies. Leadership, that's your business's brain. Marketing, its lungs. Sales are the heart. Cash flow is the circulation. And suddenly, everything clicks for clinicians because you already know how to do this. You just need to translate your clinical skills into business tools. And that's exactly what we do inside the Clinician Entrepreneur Collective. It's your small business clinical rotation, which makes me your business preceptor. Inside the Clinician Entrepreneur Collective, we take what you already know as a clinician, your incredible ideas and dreams, and turn those into a business that works, sells, scales, and actually pays you. And if you're ready to learn how to actually do that, we start our next cohort on July 1st. Head to tracybingaman.com/waitlist to join us. Kathryn, welcome to the show. Thank you so much for being here.
Thanks for having me. I'm really excited to have some time to chat today.
I'm excited to have you back. We do not have a whole lot of repeat guests, but you were a guest on episode 258. We talked about telehealth and practice ownership. So tell us who you are for those who haven't heard that episode and what you're up to these days.
Sure. I'm Kathryn Werner. I'm a PA and I own a telepsychiatry practice called White Pine Mental Health and Wellness. And I also do consulting for PAs, nurse practitioners, physicians who are launching and growing their own medical practices, whether that's in person or virtual. And I do that in partnership with a clinical and professional career consulting, so CPAC.
Awesome. So, what are some of the benefits of working for yourself? I think this is one of those things where is the grass greener? Is it better to be your own boss? Tell us what it's like over there.
Yeah, for sure. There's definitely pros and cons, just like there is with everything else. I tend to think that the pros far outweigh the cons, but that's a personal preference for sure. But for me, the biggest thing is really the flexibility. I have small children. Well, they're not so small anymore. I keep saying that they're pretty big, but I have kids. I have a lot of things that I like to do outside of work. I like to travel. We're active in our community and things like that. So the flexibility to set my own schedule, to choose the type of patients I see and how I see them is really what I love about it. I also really enjoy a challenge and some novelty. So I've been a PA almost 20 years at this point, which again is insane to say. But there comes a point in your medical career, especially if you stay in the same specialty as long as I have, where you just kind of feel like you're kind of on autopilot, even with the new things coming out, like you're keeping up and that kind of thing. But it just kind of starts to feel a little less exciting. And some people may really love that autopilot thing. For me, it was just a little wearing and a little draining. So being able to pick something up new as a practice owner, there's so much new to learn and to grow into. And using a little bit of a different part of my brain really excited me and is something that I still really enjoy. Now, I mean, again, there's also the cons to it. There's a little bit more stress. I don't even know that it's more stress. It's just a different stress, in that. And it's just different. But I think that's one of the beauties of having so many different options as a PA.
And I believe that this business, this creative pursuit, hosting this show and being able to do this was one of the things that saved me when I was feeling like that. When I was feeling a combination of bored and burned out, like I was not super challenged. And yet like the clinical medicine wasn't hard for me. The schedule, the pace, the demands of working in a high acuity specialty in an inpatient setting was way too much, right? So it was like I'm clinically bored, but I'm like logistically burned out. And looking for something, sort of turning over rocks in my life, like, is that you fulfillment? Like, is that you fulfillment? Like, are you under there? One of the things that really helped me was starting this business, which was a hobby for far too long because I didn't know how to run a business back then. Tell me about some of the common pitfalls that new practice owners run up against, especially those whose credentials are PAC?
Yeah, it's definitely a different ball game as a PA. Like we all as a society, as medical providers, we have a good framework for what it looks like to work in a corporate medical setting or even a physician owned medical setting. But there aren't a whole lot of examples. There's more now, but of PA, nurse practitioner owned practices. And unfortunately for us, there are some additional logistical hurdles, whether that's your corporate structure in some states, that can be a little bit more challenging than a physician. Like they can just, open a practice. And in some states we can too, but not all of them. And then also our supervision collaborative agreements and arrangements, put another little layer of complexity that physicians and corporate owned medical practices don't have to think about. It also sometimes adds a little bit more expense, which is a bummer, but it's just part of it. So that's one of the big things as a PA nurse practitioner practice owner that we have to think about. And I think that can be a place where people can get tripped up. So that's one of the challenges that we really see. I think some of the other things, and these are not particular, I think, to PA nurse practitioner owned practices, but just in general, as clinicians, we in school and in our training are not really educated on finances. We're really not even educated a ton on billing, scheduling, office management, taxes, all of those things, which feels really overwhelming. And there is extra stuff to learn there. But I think one of the really cool things about being, and I can only speak as a PA, but one of the really cool things about being a PA is that that's our whole jam. Our whole jam with, with our 2 years of training, we're going to hit it fast. We're going to hit it hard. We're going to get the basics of what we need to know, but we're really setting ourselves up for being able to learn later on. And so I think, if we take those clinical skills that we already have and we put it together with, okay, I don't know, but I'm really good at finding things out. And we take the same skills that we would use to learn a new clinical procedure, a new drug, a new, treatment modality, and just put it into learning about taxes, learning how to design a, you know, um, website. I can't think of the word, a website. Then we can really make some good progress there. And so it's been really exciting to do that for myself, but to watch other clinicians kind of grow in that way too.
Yeah. Yeah. It is my personal belief that there is so much of healthcare that is being administered poorly, whether through organizations that just cannot get out of their own way in order to make sure that patients can get what they need from them, from the healthcare system, from navigating referrals, insurance, hiccups and hangups. That there are so many people who are working at those places who see that, I'm going to call it a relative injustice, right? That there are certain barriers for certain patients, and that running your own practice can be an opportunity for you to overcome some of those challenges that your patients have and to meet a need that they have in a really, really meaningful way. And who better to do that than you?
For sure. And I think in working with other clinicians, we've seen that occur in so many different ways. So in my own practice, one of our big goals, and I started with just the idea of it being a little business for myself, was I want to provide medicine the way I would want to receive it. So I wanted it to be good clinical care, but I also wanted the whole experience to be easy and simple and stress-free and almost pleasant. Um, because that's what I would want as a patient. Like I want to call and speak to somebody, and I want my visit to start mostly on time and end mostly on time, and not have to drive across town and get stuck in traffic and sit in a smelly lobby or talk to a grumpy receptionist or call 40 times to get my prescriptions. Like that's not what I want as a patient. So that's not what I'm going to provide to my patients. And that feels really good to me as a provider to show up and give that good quality care. But like I'm hoping, and we hear good feedback, that feels so good to my patients too. But then when I work with like consulting clients and there's other PAs starting their practices, we've seen them get creative in so many different ways. So providing, care for mothers and kids in a family practice, but ped-centered family practice, and also looping in lactation care and school notes. So like a really kid-centered family practice has been really neat. Or we've had another provider who took the things that she loves, which were kind of felt disjointed initially. It was like, cosmetic type skin care, hormone therapy, weight management, and a little bit of like psych. And I was like, well, how are we going to package that and like make it make sense? And how is that going to impact your clients? Like, what are we going for here? And really it was when we kind of distilled it down, it was that she wanted to provide the things that patients actually care about. Like patients don't care about their blood pressure or their cholesterol. Like they all come in and they do it, but that's what they really care about. So she's now focusing on the things that people care about that maybe aren't being addressed adequately in family practice. So I think you kind of hit the nail on the head about let's provide something, a service for our patients, and meet a need that they have that's being missed in these bigger offices and the corporate structures. And we really are, especially when you start a small business, you are nimble and flexible, and you really can kind of get in there and do what needs to be done.
And that to me is one of the most stressful and the most rewarding things about being a small business owner is that you can do anything and you can do it well and you can do it quickly, but sometimes that you can do anything and you can do it sort of okay and you can do it quickly or slowly, and you might not do it at all if you don't take action, The biggest difference that I feel in stepping into entrepreneurship versus being an employee, and I would love for you to talk about, the types of people that you see in these entrepreneur roles. It's not sort of just the standard, I've always wanted to be an entrepreneur people. The biggest difference between employee versus entrepreneur is when I was an employee, I spent a lot of time, like it was my part-time job as an employee, to be the squeaky wheel. I don't think this is safe for patients. I don't think this is safe for providers. I think that's a terrible idea. What about the logistics of those transfers? What do you mean we can't get support at night or for this? Like I was always, 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 like my tagline in meetings, if I were to say, it would be like, I have questions, right? Like I have questions about this. And both from a genuine curiosity standpoint, but also, wait. You want us to do what, when, how with our current staff? Like, we're already at capacity. We don't have the ability to do that. So I was sort of constantly with my hand in the air saying, I have questions. I have some solutions, but I also have questions about how to implement that thing. You're sort of just like an edict coming down from above. That I spent years and so many sleepless nights and so much stress and so much angst over trying to fix a very, very broken system to try to get it to work for me selfishly, because I need to live a life and have a life that is sustainable, but also for patients, where there's this tug between profits and patient care, right? There's this tug between having a system where this is how we treat everyone, but everyone doesn't need the same care. What has been your experience with people who are going out and starting their own practices? Are they the squeaky wheel? Are they the like, I'm just so fed up with this, I'm going to go start something new? Like, who is taking this action?
We see such a range. Like, I wish I could distill it down into there's one particular person, but I've really been shocked that there's not. I really anticipated we were going to see a lot of people who were the squeaky wheels or who were these more like dominant personalities, like, oh, I know I can do anything. I mean, that's kind of where I come from. Like, I've never met a challenge that I didn't think, oh, I can at least try that. You know what I mean? Like, I may not succeed, but I'm at least going to give it a go. So that's kind of what I was expecting. But yeah, we get a lot of people who are just to the point of being frustrated, and to the point of, hey, I love healthcare so much. I love the interactions that I have with patients and the impact that I get to have. And also, I cannot continue to do it in the way that I've been doing it. And so there's almost this like sense that it's their mission and their calling, and how are they going to make that, and that they're willing to put in that extra effort to be able to make it work well, for them and for their patients so that they can keep doing what they love. So those are really a lot of the like themes that we see. And it's been interesting to see in our groups those different personalities kind of come together and learn from each other, and kind of grow in different ways, or to kind of meet each other's fears and answer them, or meet each other's weaknesses and build each other up in that way. So it's been a really interesting, journey to see that kind of come together.
Yeah. And anytime I hear people use the word a mission or a calling or a vocation, I immediately have this visceral reaction to that. Not because I don't think that we should be called. I think that we should absolutely feel this mission and this purpose and this passion, but because healthcare at large has weaponized that calling and has taken advantage of so many well-hearted, well-intentioned clinicians who are like, this is my calling. I'm going to leave it all on the field. I'm going to take care of these patients at the cost of myself and my relationships and my life. Talk to me about boundaries inside of entrepreneurship. In healthcare, we're bad at boundaries. Are healthcare entrepreneurs doing it any better?
I mean, I would like to say yes, but it's definitely, when we leave clinic because we're not awesome at boundaries, or boundaries feel uncomfortable, and we move into an entrepreneur space, the boundaries have to shift. They're not the same pressures and the same things that you're setting boundaries around, but you still have to set boundaries. And so I think if we're not diligent to do that and mindful and intentional, that it can be really easy, to kind of build yourself into a hole, and just kind of get in the same problem that you were to begin with, but around things. So if it's working too much in clinic, now it's working too much on your books or your marketing, or seeing more, patients outside of hours because, well, they really need to. And so I definitely think it's something that has to be really purposefully thought about. And we in our programs really start from that place. We don't launch into building the business, setting things up, doing your marketing. We got 6 modules, and one of them, of those 6, is before we do anything, let's figure out what you need, what's going to work in your life. Because if we're not protecting your time, your energy, your desires, then this is not going to be any better than what you left. And then you're going to burn out, and it's going to be, possibly even worse than it was before, because now you have ownership and seeing patients for a lot of people. And then our last module is kind of the wrap up of that. Like, okay, we've started this business. How do we reflect on it and make sure we maintain those boundaries and maintain some self care in a way that's healthy long term?
How has that journey been for you in the launching and scaling of your own practice? Everyone hates answering this question. They're all like, well, I'm doing it imperfectly, right?
Oh, yeah. Well, it's interesting that you asked today. Because yeah, in as there have been seasons where I've been really good at it. There are seasons where I nail it. And right now is not one of those. We've had some just like really big changes as a family, and so that have upended everything. Our family routines and systems are completely askew at the moment, and we're just kind of having to like rebuild them and restructure them. Well, I built the whole practice around my family's routines and rhythms, and so now we're having to go back and just kind of rebuild the practice, honestly. And it's been challenging. So I'm now homeschooling one of my kids, and so it's like, well, how am I going to do that and see patients? Like that's not ideal. So you know, shifting who I see, when I see them, my role as an admin, when we're doing work at home, what school looks like, those type of things are all having to be completely redefined. So it's definitely a season of flux around here. But I'm confident that as we navigate through those and knowing what I know about boundaries and needs and all of that, that at some point, when I have no idea, but at some point we'll get back there again, to being a little bit more in balance.
Yeah. Yeah. It's fascinating. I have really been playing with this idea about businesses like a human body. So there's these different organ systems, that there's these different things, and that when one thing shifts, right? Like people don't go into hepatofailure only, right? They go into hepatorenal failure. And why does that happen, right? Because these two systems are related. So when something is out of whack, metabolically, logistically, structurally, functionally in a body, that there are other compensatory mechanisms, sometimes for the good of the patient, sometimes to the detriment of the patient. And the same is true in life and in business, that when one of those things shifts, that everything else has to adapt around it. Sometimes for good, sometimes, you're like, this is really hard. And I sort of had it. I was cruising, right? I was at cruising altitude. We had a great metabolic thing going. And now suddenly we're having to adapt to this new demand, to this new supply, to this new whatever. But that in a business where you are the decision maker, in a business where you are in a seat at the table of leadership, or you're the only one at the leadership table, which is often how many of us start, that you get to decide. Whereas if that happened to you, right? Let's say rewind, you never started your practice, right? You're now, you're working as a psych provider, you're providing telehealth, maybe from home, maybe you're going into the office, and suddenly your family needs shift and your kid needs to be homeschooled. And that is the number one priority. We all say our family is our number one priority. If you have to ask for permission to prioritize your number one priority, is it your number one priority?
Yeah, and there's so many days where I'm struggling with like, oh my goodness, how is this going to work? What does this look like? How are we going to move forward? And I'm like, well, heck, at least I've got options at this point. Where if I was working, at the clinic down the road, they would be like, well, you got to be here from 8 to 5. Even if it was part time. Have most recently worked for other people part time, even 20 hours a week if it's on somebody else's schedule, and I can't flex and adjust the way that I need to, would just be it would either come to quitting or just being a like I would have shut down by now. So, it's really been a blessing. It's definitely a challenge, but it's been a blessing that this was kind of already set up and mostly running. And now we're just adjusting instead of like, completely out of sorts and, building something or starting from scratch. So it's been a really great thing that this was here.
Do you feel like as your business has matured, it has become more, if we're going to use this body analogy, metabolically stable? Like you've gotten to the point where, you're not figuring out how to run a business. You're not figuring out how to get patients in the door and bill their insurance and do their notes and have an EMR. So like that stuff you got down, and now you're having to sort of restructure when you see them, which is one variable, not seven. Do you think you're at a place where you're like, hey, I actually was ready-ish for something like this to happen, and here's what I did to sort of mitigate that risk to the business? Are you the only producer? What are some things that you've put in place to help mitigate that risk?
Yeah, again, just kind of luckily over the last, I guess we hired our first new PA 2 years, first like additional PA about 2 years ago. So yeah, I mean, that was not the intention. It was like, hey, my schedule's full. We've got a great PA that I love who needs a job. Let's just make that happen. And so we did. But yes, I mean, it has been, and then just happenstance met another really cool PA who was looking for a little part-time thing. So we added him in before any of this started. So it's been really an amazing flux that we were in kind of naturally, so that as I'm like, oh, I can't see any more patients, I've been able to shift some of my patients over to their schedules. And I know, like you said, the systems, the billing, the marketing well enough that I can kind of run those in, shift a little bit, but run those mostly in the background. I also already had an assistant, which heaven help, I couldn't have done any of this if I didn't have a solid assistant who knows what's going on. And so, having all of those things, kind of teed up, which again was not at all my intention. I was like, well, it'd be nice to have somebody else for a little extra money. And then also if I need to take a vacation or, whatever. But having those things already lined up, yeah, I mean, we were well positioned for this shift and change. As hard, it's been stressful and challenging, but things are in place to support that. Where had this happened, 10, not 10, 5 years ago, it would have just been me. And it would have been a different, scenario. So it's been again challenging, but it's been good, where we're at.
I'm hoping that you will share with some degree of transparency and whatever you're comfortable sharing with our listeners. We've talked about the flexibility, right? That ability to hone this and to make it work for you. Let's talk a little bit about the financial aspect of running a practice. It sounds like a huge investment, a very big risk. What has been your experience with like startup cost and like getting this thing to making money? What's the lead time? What is the investment for someone who is, let's do probably telehealth and also an in-person practice?
Yeah. So for my practice, I started in 2019, and, I had a few people that had started practices that I knew, right? I didn't know anybody had started any virtual practices. So it literally was like me and my notebook and when, my laptop, when my kids were taking naps, like that's when we were doing this. So I also am very risk averse with my money. Like I don't like to risk my money. So that's kind of like the scenario with which this was built. So it took me about from the time I decided I was like actually going to do this to the time we were seeing patients about 6 months. And again, this was in the context of this is pre-COVID. Like telehealth is not a thing. I mean, it's a thing, but it's not like a known very entity at this point. Yeah, and so that added a little bit of complexity. I also physically lived in Alabama, but because of the laws, started out of Idaho where I'd practiced before. So that took a little bit of a minute to figure out. Finances, we were able to keep it very low, so under $10,000. Because I mean, realistically, you need like for telehealth you don't need much, like you already have a computer that does the things, I needed a lawyer to check over some stuff, money for malpractice and money for a website and things like that, but it's relatively inexpensive, especially if you're doing a virtual practice. So that's kind of what I did. And as I'm working with business clients, that's kind of what we see is that they're able to do it even less expensive and with greater expediency in most states. Now, your state definitely is going to have a lot to do with that. If you're in a heavy corporate practice of medicine state, you're going to have a little bit more cost on legal fees or potentially an MSO setup or things like that. And the timing might change, but now with the way we've consolidated and put our program together, we have a lot of patients that within 90 days, business owners that within 90 days are able to like from get see a patient. So that's kind of what we're looking at as far as lead time goes. Now we work with some for inpatient in-person practices. We work with a lot of people who want to be really lean with that. And so we've got ways we can go about that even in person and keep things very lean. Uh, Whether that's a shared office space, part-time office spaces, or getting creative with where you go. We've had people start their practices doing in-home visits so they didn't have to commit to a space. They go to the patient's houses to keep that cost down, and they enjoy that. And then we work with other practices who are like, no, we're derm aesthetics in LA. We need a space and we need lasers and we need all these things. I mean, the sky is really the limit to how high you can go. I mean, you really can spend a lot of money if that's what you want. Um, but for those of us like me who are just like, hey, I want to start a small little practice for myself and that kind of thing. You can keep it really lean at the beginning and then grow. And then for myself, once I had that income coming in, once I'd proven the the plan, then it was like, okay, well, now I can spend a little bit more. I can, because now I'm not risking my own personal money. I can spend a little bit more here. I can grow in this way. I can, hire an assistant or a marketer or, the other things to grow that way. But again, it's really your personal preference. We have some people who just out of the gate want to go big, and we can help support that, and they can do that too.
Talk to me about how you knew it was time to hire someone. Was that objective? Was that subjective? Hey, I can't go on keeping doing this. I need to see patients to generate revenue. I need someone to offload some of these admin tasks. What did that look like in your world?
So are you talking a clinician or a assistant type person, or either? Both. Okay. So for an assistant, it really was like, I can't keep up anymore. And realistically, it was just going to be more cost effective. So again, I'm operating within boundaries. I have this many hours of my time that I can devote to this practice. And it's going to make a lot more sense for me to be seeing patients and billing my patient rate than it is for me to answering the phones or doing verification of benefits. So as soon as my time got full, it was like, okay, even a little bit before, it was like, okay, I need to start finding some assistants. And honestly, I went through probably three different companies for an assistant before I found one that was a really great fit. So I kind of am glad that I started early before it was a huge pressing need. That way I could train her and get her up to speed before it was really like, oh crap, we've got to have some help or I'm going to lose my mind. So that was super awesome. As far as hiring another provider, I mean, I swore when I started the practice, I would never hire another provider. Like I wanted to be just me and my business and just show up and see my patients and make a little money. Like that's really where we started from. But as I kind of saw how well things were working for myself, for my patients, and then also seeing how many other PAs really want to practice the same type of medicine with the same type of flexibility, it just kind of became well, this is what we're doing. So happened to know a great PA that was kind of looking for some additional work. And we honestly, she and I are pretty good friends. So we kind of bounced the idea around for a while, probably 2 or 3 years, and it just wasn't the right time. And so when it was finally the right time for her, we just made it happen. And so that's been great. And then kind of my second PA was kind of the same thing. Like, okay, we kind of grew and bumped into the right person at the right time. But, I work with other practice owners who are a lot more systematized and a lot more structured about that. I talked to one person who said when she herself, and she worked full time, was earning enough to cover her full time salary, practice expenses, and another person's salary, is when she hired another provider, so that there was like that assurance that, like, yes, she wants to earn more than that, and the goal is to earn more by hiring another person, but that she wasn't going to lose anything that she needed. And then she had that buffer, and so that was kind of her threshold. And so that can look a lot of different ways too. You can do a 1099, you can do an employee, and there's pros and cons to both of those scenarios. And so it is kind of important to think all that through, and there also becomes a point where, like, well, okay, there's no 100% right answer. I'm just going to try something and see what happens and then adjust. So that's kind of that's what my journey has looked like in hiring other people. But
I would love for you to take an opportunity to share with people what the consulting looks like, what those programs look like. There are so many hurdles, especially for people with PA or NP after their name, in terms of people are going to tell you no, people are going to say you can't practice independently in the state, so how could you own a practice? What does that look like, and how do you serve those people in that space so that they get from that 6 months to that 90 days? So they get from that big investment with a lot of unknown to as lean as possible, as quickly as seeing patients safely and protected as possible.
yeah, we really run the span from, okay, I'm just considering it and like, oh, that's kind of a neat idea, to really helping people grow and expand their existing practices. So we have free resources. Once a month, we do a webinar where we go through the pros, the cons, what that looks like to own a practice, and just give people that information. We also have our practice launch lab where you get materials, and this is our kind of lowest cost option. So you get some materials that walk you through what, your practice could look like, and then also kind of audits where you're at as an entrepreneur. And that's for people who have either just are still kind of thinking about owning a practice, but also for people who already own a practice. Like, we can audit where you're at with those. And then we do a 1 hour group session once a month to answer any questions that come up from that. Then, kind of our signature program is the Practice Building Blueprint. And this is our 6 month program where we provide you from idea to setting it up. We talk about finances, marketing systems, and then kind of growth and longevity. And that is just a really phenomenal program where people can start their practices with support. So you're not doing it alone. You have a roadmap. It's all listed out in there. And then we come together twice a month for group sessions to kind of share ideas, but also like keep accountability and support each other and make sure that everybody's kind of feeling the way that we need to feel in this process. And so that's kind of our signature program. And then we move into the Practice Building Accelerator. And that's for people who are already seeing patients in their practice. It could be you've just got to, just started and have a handful of patients. It could be you have a couple of other providers that work with you. But in there, we kind of work through those same areas: systems, growth, structure, marketing, but in a different lens, and in a different depth that really applies to those larger practices or those people already seeing patients. And so that's a group meeting twice a month as well. So again, we really can support people on the whole range of needs for practice ownership.
Perfect. And where can people go to learn about all of those programs and see pricing and how to engage with your services?
So CPAC team, so CPAC team.com is our website. There's a specific area for practice ownership, and then we've got a practice audit tool that I was talking about. We've got that free on our website, so you can get resources there. We'll provide a link for that too. And then we also have our Instagram at CPAC team. And then we're on Facebook too. So CPAC team there as well.
Awesome. We will link all of those things in the show notes. I really want these entrepreneur episodes to serve as both hey, look at what people are doing and you could do it too. And also, listen, feels very isolating. It feels like you're the only one who has sort of stood up and said, clinical medicine isn't working for me. I'm going to go build something of my own. And it can feel very lonely and very confusing. And it's easy to feel like you're the only one. You look around and 99.9% of clinicians are employees for life, and they're going to stay employees and they're going to be employees. Fine, that's great for them. But connecting with those other people on this journey, so important.
Yeah, it's a really cool thing to see people come together that have different experiences, but then share. And not only do they get the actual, we would think about it as like clinical pearls, but just the camaraderie and the shared experience, like you said, can help decrease those feelings of isolation and kind of keep you energized about what you're doing, which is so important, to kind of love what you're doing and being excited about it. But sometimes you need some other people along there to kind of keep you in the game, because we all have moments where we're not feeling it. Like, as much as I love owning a practice, sometimes I just don't feel it. It's short-lived, but it's always nice to touch base with somebody else who has that same experience, to kind of bring me back to center and reset things.
Absolutely, Kathryn. Well, thank you so much for coming on the show and sharing your vast experience and wisdom. We really, really appreciate your time.
Thanks so much for having me. It's always great to chat with you, Tracy.
If entrepreneurship has been on your heart or on your mind, I want you to hear this. The Clinician Entrepreneur Collective exists to help clinicians avoid 6 of the biggest reasons that small businesses fail. And small businesses fail a lot. Those reasons are an unclear mission, products that aren't profitable or in demand, inconsistent cash flow, weak sales, ineffective marketing, poor management with too much overhead, and disorganized accounting. We help you to fix those problems before they become problems. The Clinician Entrepreneur Collective, it's preventative medicine for your business. Whether you have an established business that you're looking to grow and scale, whether you have an idea for serving the world through a nonprofit, whether you want to start a practice or start a business guiding other patients through the healthcare system, which is not designed for ease of use, you want to make sure that that business is healthy like a human body. Our next cohort starts June 1st. And if you want in, here's what I want you to do. Head to tracybinghamon.com/waitlist. Add your name. Watch your inbox for an invitation. That's it. You don't need to go back to school. You don't need an MBA or a doctorate. You don't need permission from your admin team. You do need a plan for how to grow your business to support yourself so that you can practice medicine electively on your time and on your terms. We'd love to have you join us. The next Clinician Entrepreneur Collective cohort starts June 1st. That's all for today. This entrepreneur is out.